So my name is Mariah, and I am going to dive into schizophrenia. A little side note, all of the pieces of artwork attached were actually done by artists who are diagnosed schizophrenics. So by now, I'm sure we know schizophrenia is a neurological disorder where reality is abnormally distorted. Common symptoms include hallucinations and delusions. Many people start exhibiting symptoms and are diagnosed between late adolescence to early adulthood. Childhood schizophrenia, which is what I'm going to address, is possible but rare, and the individual usually does exhibit more severe and persistent symptoms. This quote I found interesting. It's actually a mother commenting on her young daughter's schizophrenia hallucinations. I just thought it was interesting to kind of get a glimpse into this girl's mind. So I'm going to dive into this case study. Obviously, a 14-year-old boy. As I said, I was addressing children. He only had up until a 6th grade education due to dropping out due to his schizophrenia. He experienced his parents' divorce at age 10, where his father was allegedly abusive. His academic decline began at age 11. Writing skills started to deteriorate. Lack of attention and cooperation in a classroom setting deteriorated, and he overall started severely acting out. He experienced commanding hallucinations, screaming at him at age 12. He had a strong delusion these voices were his family just teasing him. These symptoms ultimately were what led him to drop out of school. So at age 14, he was prescribed sodium valproate. He declined. So sodium valproate is typically prescribed as an antidepressant for patients with stuff like bipolar disorder, which is what his psychiatrist originally thought he had. Valproic acid can cause psychosis, though, because it increases levels of GABA in the brain. Obviously, we're fighting fire with fire in this situation, which was what ultimately led to his decline, as you can see. After a trial and error period, he was finally diagnosed with schizophrenia. 2 out of the 5 main symptoms, which is required for a diagnosis, according to the DSM-5, were present. He was then prescribed a concoction of antipsychotics, which ultimately gave him significant weight gain, and it resulted in his overall refusal to take the meds. He ultimately relapsed after a few months. He continued to decline and eventually was hospitalized for noncompliance with meds, increased hallucinations, delusions, and aggressive behavior. He refused to cooperate with any mental examinations. He was observed laughing to himself, muttering. No insight to his illness was noted, which is very common. And he presented laconic speech, which is basically very few words. Multiple tests were performed to rule out a variety of underlying issues, such as Fragile X syndrome and autoimmune encephalitis. All of this testing came back normal. Ultimately, electroconvulsive therapy was administered. This has a bad stigma. It is not what Hollywood depicts. I don't have time to get fully into this, but basically it rewires the chemicals in your brain, and these rewirings build off of each other to ultimately get rid of some of the symptoms with schizophrenia in his case. This actually resulted in no more hallucinations, delusions, or aggressive behavior, but the weight gain, poor academic behavior, and some behavioral issues did continue, and this is kind of where his case study was left off. So I'm just going to touch on a few of the topics within the case study to elaborate on them. So patients with psychotic disorders often report childhood abuse and neglect, actually up to 70% of them. Some doctors are able to find sufficient evidence that certain types of abuse can actually correlate to certain symptoms, neglect being negative symptoms and abuse being positive symptoms. And this claim actually does go hand in hand with this boy's positive symptoms of hallucinations and delusions, correlating with the claim that his father was actually abusive towards him. And lastly, obesity is common in schizophrenia due to the medications prescribed causing weight gain. Antipsychotics impair with glucose metabolism and increase triglyceride levels. There's a study concluded that schizophrenics regularly taking their meds, antipsychotics, had a higher body weight. It's directly correlating with taking the medications. There is another study that does suggest Long-term inpatient individuals do overeat in the hospital, as many of them seem to come from unfavorable conditions such as the streets. So in other words, the hospital is their first good meal, and they have the ability to overeat and get fat, for lack of a better term. But we're going to assume that the first example is more relevant to this 14-year-old boy. Excessive weight gain overall can lead to depression in anyone. So depression can cause many schizophrenic symptoms to heighten, which obviously just turns into a cycle, which is one of the reasons that this disease is so hard to treat. We see a lot of relapse and trial and error periods, as this boy unfortunately experienced.